Welcome to Healthcare Upside Down with your host, Dr. Nick Vanterhaden, and brought to you by ECG Management Consultants. You can learn more about the show on the program's page at healthcarenowradio.com or on our blog at ecgmc.com/HUD. The U.S. spends more on healthcare per capita than any other country on the planet. So why don't we have superior outcomes? Why haven't the principles of capitalism prevailed? And why do American consumers have so much trouble accessing and paying for healthcare? Each week, Healthcare Upside Down will dive into these and other issues with ECG principal Dr. Nick and guest panelists as they discuss the upsides and downsides of healthcare in the US and how to make the system work for everyone. And we end with your better pill to swallow, the conclusion to today's episode with insights on challenges and changes that improve healthcare. Now here's your host, Dr. Nick.
The Hospital Price Transparency Rule went into effect on January the 1st, 2021. Despite huge efforts by many institutions who fought the regulations tooth and nail to the bitter end. The clock ticks forward and we roll into January of 2021, but the results were disappointing at best. In the state of New Jersey, a grand total of 2 hospitals from a total of 10 were compliant, with the others unambiguously non-compliant. And these statistics were typical throughout the country. Those that did comply posted information, sometimes buried deeply in their website, and what was posted came in a wide range of shapes and sizes, sometimes with detail, other times just averages, essentially the minimally compliant version. The ruling was designed to let the patient or consumer know the cost of a hospital item or service before receiving it. But that ideal is not being fulfilled, at least not yet. And with the current enforcement fines set so low they barely register as a rounding error for many institutions, it's not looking good. But these rules, and more importantly, most contracts or administrative service agreements with your carrier, have an obligation to make sure all of their in-network facilities are compliant with the federal rule. That means the healthcare line item on your income sheet just got a whole lot more detailed, offering the opportunity to manage it like every other expense in your business. Join me on the Healthcare Upside Down podcast as I talk with Christin Deacon, the Senior Vice President for 4C Health Solutions, and previous Deputy Attorney General in New Jersey, where she ran one of the largest health plans in the country for the state of New Jersey and is credited with saving the state millions of dollars in their healthcare costs. Chris, thanks for joining me.
Thanks for having me.
So employers are essentially burdened with the cost of healthcare, and we've been watching this climb for the last, goodness knows, it feels like my lifetime. How do we turn this around? It seems like this is just a train that is never going to stop.
Yeah. It's funny that you start with that we've sort of been watching this happen as if it's some abstract, inevitable foregone conclusion that trend will increase 5, 6, 7, 10% year over year. And we kind of observe it and have been passive observers as, large employers and those that are, largely paying the bill, taxpayers, employers, and employees. It's not a runaway train. It's a train that we have the keys to or to stop. We just have to have, the intestinal fortitude to do it because it's not going to be easy. Whenever anything takes up 17, 18% of GDP, if we are ever going to change that number or drive value with that number, somebody, will be taking home probably a smaller paycheck. And so, we have to be prepared to take on those entrenched interests.
You immediately raise my antenna when you say, I'm going to be taking home a smaller paycheck. You know that those are vested interests, and they're not just individuals. That's large organizations. It's not just about the paycheck. This is about the money flow. And that seems to be the problem with this train, is that there's so many people that are pulling in the direction. It doesn't matter which thread. So where do you start? What is the process for this?
Yeah, I mean, I think that, again, first, the realization that we have to recognize that there will be losers in this game. And whether that's the, pharmacy benefit managers, the third party administrators, or some of the hospital systems that, continue to build glass palaces as a form of community benefit, right? And largely profit from a nonprofit status. Something has to give. And I think that, again, recognizing that at the outset is really important. But there is a pathway towards what I'll say, value. And I think the quicker those organizations that I just rattled off are going, to start transforming into that value agenda, there will be a place for them. But we can't keep on the trajectory that we're on. And I say that, and that's not an foregone, conclusion. If we don't actually do something about it, you and I will be sitting here in 3 years and be talking about 22%, 23% of the GDP going to healthcare costs and probably not having any better health outcomes, possibly worse.
I'm just going to say right out, it's almost impossible that we will improve health outcomes with an increase in cost. It's inevitable that you can't just keep pouring money into this. So
right.
We've seen some moves. There's certainly some regulations that I think have delivered some potential insight. And I think one of the areas that you've focused on is transparency. If we don't know what the pricing is, we saw an interesting piece of research that took place. It was out of the Hilltop Institute with the New York Times, and they did some research on all of the data that was published because of the regulations they were required to. But they had to do a deep dive. That was a complex project. And then the response was from the institutions that looked at the summary of their data, oh, we'll pull it back. That feels like we've just taken a step backwards, even though the regulations are enforced. And you've been on that side of the coin. How are we going to push this so that continues, so that we can all get that transparency that seems an incredibly important part of finding that value, as you described?
Right. Well, it's really the starting point, right? How do you find value if you don't know what the sort of your baseline cost is? And, on transparency, I had an analyst team in place, just chomping at the bit for January 1st, 2021, to really dive into New Jersey's hospital systems and their files that they were supposed to upload. And, by January 3rd, I had to put that team on another project because it was very clear, both from the hospitals and from the carriers. The carriers knew that there weren't going to be postings because, they don't stand to benefit from that either. And to put them on a different project because we knew that it would be, an exercise in futility, of those that even complied, that, it was either averages that were disclosed. It certainly wasn't fully compliant. I think we had 2 hospitals that were compliant on day one. And so the exercise really became meaningless. I attempted through our contract to actually mandate that the carrier require that the hospitals post transparency. And this is something I've written about. I guarantee you, if you have any self-funded employers out there or, public sector entities, if you look at your administrative services agreement with your carrier, they probably have an obligation to make sure all of their in-network facilities are compliant with federal rule and regulation. And so I tried to use that as a hook to get them to enforce compliance. But there were actually some, political forces at play that, picked up the phone and said, Christin, what are you doing? We don't really want to rattle anybody here. It's a very complex regulation. And I'm thinking to myself, if they know what the prices they're charging because they're charging our plan for it, then how difficult must it be to put on a file to read, But yeah, there's at $300 a day, $109,000 a year for being non-compliant. I don't think that anybody really cared if they were compliant from the get-go. And that was evidenced by the American Hospital Association filing up until December 27th an objection to the law. And even now, I think, I think the most that a hospital could suffer with the enhanced CMS penalties is maybe $2 million. Like, that's a drop in the hat, right? New York Presbyterian in 2019 was sitting on an $8 billion reserve. $2 million is less than a rounding error. And if it preserves their business model, I don't see that type of enforcement having much value. I think it needs to be much steeper.
Which makes Mickey Tripathi's comment, the minimally, please don't do this minimally right. viable compliant version. And interestingly, the outcome from that study was that they essentially found the groups that you described, which were the unambiguously non-compliant hospitals. They were the vast majority. I'm right. just curious, out of the New Jersey, what's the total? What was the denominator? You had 2 that were compliant. What didn't comply, roughly?
So we have, north of just like around 10 large hospital systems. And I say that as sort of a fluid number because, as you know, hospitals, I think there's a big case, and several attorneys general across the country just filed a case to prevent a merger with 2 of the big hospital systems in New Jersey. So roughly 10 large hospital systems. But I'll tell you what, I spoke with our large TPA providers prior to January 1st, 21, and it was very clear from their assertion that none of the hospitals had any, and they had no plan for compliance, and it was a very strategic non-compliance, which is, again, back to my, I think I've said this, in writings and in prior conversations, the solution in healthcare is not going to come from Washington. I don't think it's going to come from state policy leaders. I think the solution in healthcare, at least the catalyst for change and moving us along that value chain, is the large employer market. Because, what we've seen at the federal level and in some ways the state level, if we're talking about, some of the new CMS pilots, innovative strategies, we're giving out a lot of participation prizes when it comes to value, moving to value and value-based payments. But we're not really hammering home the fact that there has to be a downside. We can't keep handing out more carrots. We have to have some bigger sticks. We have to make doing the right thing a lot more attractive to our provider community. And we have to make doing the wrong thing or the inefficient thing a lot more unattractive from a financial perspective.
So enough of the carrots, more of the sticks. And that's tied up a little bit with regulatory, but I think it's interesting you focus on the employers. They have a big problem, right? I mean, this is a huge contribution. There's a part of me that says, why on earth are they in this business? I mean, does it really make sense for employers to be offering? Is right. that even a plausible pathway to say, let's get the employers? And I'm not advocating to have the government do this, but a separate entity that is disconnected from employment. Is that
right?
High in the
well,
sky?
I think, we could spend hours talking about how we got here from an employer-sponsored health plan perspective. But at the end of the day, we are here after decades of this system growing up. And, we could talk about the history of, the tax benefit for, health benefits being offered through the employer because it was the only way that you could get out of the wage cap, et cetera. But we're here, right? And employers, by and large, employers are footing the bill and passing it on to employees in terms of premium, foregone wages, et cetera. But the system is that, and I've spoken to whether it's a trucking company or a large retailer, and, I want to talk about healthcare, and, that's my HR department. We're in the business of logistics. Well, do you offer a self-insured health plan for your 200,000 employees? Yeah, we do. What is that on your line item, from a spend perspective? Well, it's a lot. Like it or not, employer X, you are in the business of healthcare. Now, how are you gonna manage that business? Because I guarantee you have an inventory system for what's on your trucks. You have an inventory system for how, or a management system for how you're going to control costs on, your gas mileage and your drivers. Why aren't we thinking about our healthcare spend in the same way when it makes up such a huge percentage of our spend as employers?
And you bring up that point. As I recall, the cost contribution to a car manufactured in the United States is somewhere of the order of 20 to 30% is healthcare cost. Is that somewhere in the
That sounds about right. That sounds about right. And I think on the labor side in particular, when you're talking about organized labor, it's a very real narrative, right? Like they very much see, okay, I'm getting $18 in wages and I'm getting, $18 in health benefits, because by and large they're Cadillac plus plans. So that labor union, in my opinion, right, they need to make sure that their employer is spending their money wisely, or that trust that is holding that money is spending the money wisely. Because for the most part, and there are some exceptions, right? 32BJ in New York, Rosen Hotel Group, but by and large, these employers or trust groups that are responsible for managing this vast amount of money have basically outsourced that responsibility to their third-party administrator or to their pharmacy benefit manager, and have sort of, said, all right, well, I trust that they're going to do what's in my best interest. And I think anytime the financial picture, if you spend more money and they make more money, well, I think it's time. And I think ERISA now says we have to put ourselves back in the driver's seat, take some ownership and responsibility of the management of that health spend. And, we could talk about some of the tools that ERISA gives us as self-funded employers to do that. But, it's not a nice to do. It's not a way to like find some savings. It's a legal, obligation for plan fiduciaries and trust funds. And it actually is an opportunity, right? Think of the social impact that spending almost 18% of our GDP has, without getting better health outcomes, by the way. I mean, we spend less than 4% on education. We spend less than 1% on preparing for climate disasters. If we're to look at the societal, opportunity costs and an employer opportunity cost, you could invest that in more mental health resources or better primary care, which would, improve your members' health, productivity, et cetera. But it's really time to put that group back in the driver's seat, because it is their money at the end of the day. It's employees' money, and whether it's in foregone wages or premiums. And the days of cost shifting to save, they're over, and they don't work.
I think it's really interesting. You bring up a point, because almost universally when people talk about this and organized labor and, this high cost, they talk about, pulling that back. It's, let's go find a way to reduce that cost. And actually what you're saying is, no, that's their money. They've invested in it. That was part of the compensation package, but they're not getting value for money, because the whole process essentially says, oh, well, we'll just keep paying what we need to pay. So underlying all of that, you talk about ERISA, you talk about the potential. It feels like the transparency piece. And then the other element that I heard very clearly is, treat this just like your business. Why are you not managing this? Right. Tell us a little bit about how you see that.
Yeah, I mean, so I've heard that sort of position that, I'm an employer. I don't really want to get involved with how my employees interact with the healthcare system, right? In what other, I sort of, if you were to hand your employee who has family coverage with your plan, some of these union plans, let's say, $30,000, $40,000 a year in value from a premium perspective. Here's this $40,000 piece of equipment. Good luck. Not only am I going to leave you with no instruction manual as to how to use this, I'm not going to give you good, never mind the days of like going to any provider you want. Like, I really want you to go to the best knee surgeon, because I want you to be able to come back to work, right? I really want you to undergo physical therapy before getting a spinal fusion, because if you go to a surgeon first and a poor surgeon, I mean, the number one cause of spinal fusion surgery is a failed spinal fusion surgery, right? The American healthcare system, if interacted with in the wrong way, can be one of the most devastating and deadly things to your health, again, if interacted with in the wrong way. So I think we have an obligation, again, if an employee might say, if they're on a business trip and they want to stay at the 5-star Ritz-Carlton in, Hawaii, well, that's you're paying some of that. So I think you have a say, like, let's stay at a 4-star Hilton or something that is actually has value. And I think that empowering our employees with good information, that quote unquote instruction manual is really important. Not just because it's in our financial interests, but I go back to that phrase that a lot of people used when we were moving towards consumer-driven health plans, and that, well, they should really have skin in the game. Let me tell you what, a member that has cancer and that is looking for the best cancer care for their child or for their spouse, like, they don't have to have money in the game to have skin in the game, right? And so I think we need to do a better job as employers and making sure that our members are getting the right care at the right time, and we're getting value. When value is defined as, outcomes achieved relative to cost, right? If I get improved outcomes, I might be willing to pay a little bit more. If I pay less and, at the cost of quality, that's not value. And it's certainly not going to be good for my members. So,
you bring up an interesting point, the deadly potential for the healthcare system. And I would say the counterpoint to that is that there is an equally amazing potential outcome for the system, but you essentially roll the dice every single time you interact with the healthcare system. And sometimes it's geography, could be your employer, could be, and we have to normalize that as part of our sort of activity. So if you were to pick the key element in this to make that normal and to allow us all to get the best possible, and crikey, we're paying 18%. We ought to be getting the best healthcare in the world, but we're definitely not. What do you think that is?
Yeah, I think, that's a big question. And to focus on the population that I think will, or population, the influencers that I think will get us there is the self-insured market. And when I say that, I mean also state plans like the one I ran, which was, it's the 4th largest health plan in the country, and other self-insured groups demanding transparency and value. And I think, again, not to get too wonky, but, ERISA, which by and large governs these plans, not only makes it possible, but makes it your obligation to understand your costs, understand your quality, understand all fees that you're paying, evaluate those 3 things, and make sure that you're spending your plan's money wisely and in a prudent manner. And I think that gets you there because we have the transparency tools and regulations. We just have to use them. More sticks, less carrots. We can't continue to grow the pie, right? The pie is going to swallow America. So I think within those bounds, we have a lot of unique opportunity. But again, I have to think we have to recognize that this isn't going to be easy. There is not some quick fix solution out there, despite all of the billions and billions of dollars in capital from private equity going into digital health tools and digital transformation tools. Those all can play a role in this ecosystem, but the ecosystem has to fundamentally drive towards value and not in these siloed entities that are profit seeking.
Chris, thanks for joining me on the show today.
Thanks so much for having me. Anytime.
Healthcare costs contribute significantly to the cost of goods sold in this country. And while everyone is involved, we need more committed to the solution. The solutions to our healthcare challenges are not coming from Washington. They're not coming from states. And while individuals can bring about some change for their own local issues, the real movers in this space are employers. Labor unions and employees should insist their money, and it is their money since it's part of the compensation received in exchange for the work done, should be spent wisely and not squandered. That means getting the best possible care for the most economic price. What is that line item of cost for healthcare benefits on your income statement? And how much transparency do you currently have into the details? Has that cost been shrinking like others in your divisions as you sort out savings to improve your business profitability? Or did you hear year after year that the costs are just going up and there's nothing, aside from shifting more of the cost to employees, that we as a business can do about it? This week, your better pill to swallow is to reject the notion this is a runaway train, accept there will be losers in this business, and change starts with employers focusing on the detail of their healthcare expense line items on their income statements with the same vigor and attention as every other cost. No longer can you accept the rising cost of care while quality and outcomes decline. Accepting the fact that employer-sponsored healthcare is here to stay in the United States does not mean accepting the continued rising costs. Control and influence lie with the employers, and by extension the employees, all of whom must insist on price transparency. Executives must be equipped with all the details so they can reject the notion that cost increase is inevitable and seek alternative health delivery options that can and do cost less while delivering higher quality care. Thanks for joining me, your host, Dr. Nick, on this week's edition of Healthcare Upside Down. Until next week, keep solving the business of healthcare as if your life depended on it, as one day soon it will.
That's all the time we have for today. You can find all of our episodes on your favorite listening platform by searching for Healthcare Now Radio. Also, check out our blog at ecgmc.com/HUD for summaries and commentary from each episode. Follow our show's social hashtag, HCUpsideDown. And join us each week as we work to solve the business of healthcare for everyone.